Naren, this is one of the 6 fundamental principles of influence at play with Robert Cialdini.
Yes.
Because what you're doing is you are identifying something that the patient likely already knows. They already know they have crowding or spaces.
Right.
And then you're leveraging the moment to let them know something could be done about it.
Mm.
Now, again, if they have no interest, fine. No hard feelings, no problem. We just move on. But you'd be surprised how many people will say, especially in the social media era that we're in, Naren.
Zoom, right? Zoom.
Well, Zoom,
Smile. Yeah.
and Instagram.
Yes.
A statistic that I've shared with our listeners is 67% of all people on Instagram have photoshopped, their images, have photoshopped their own profile images to look better on their Instagram profile. Now, and I'm not talking about a filter here, Naren. I'm talking about photoshopping, changing the color and shape of their teeth.
Right.
They're interested in this. They're interested in this. Now, if you want to get more sophisticated about it, another thing that you can do is make sure your website showcases the fact that you do adult orthodontics. Make sure you have landing pages around adult orthodontics. Make sure your keywords and key phrases are all dialed in. Make sure that not only the keywords and key phrases are dialed into the copy on your landing pages, but make sure your coding behind the curtain is coded so that when someone types in all the phrases they might type in looking for adult orthodontics, that your office shows up on page 1. And that's a way to bring new patients into your practice that are specifically looking for that. The strategy of looking for crowding or spaces is to talk to your existing patients about it. And this practice proves that there were tons of people in this practice that had the condition, and they just didn't know that something could be done about it. And they perhaps didn't know that this office provided it, that it could be provided right there. If you have a relationship-driven practice, the patient wants, if you can provide the service, they want you to provide that service because they don't want to go somewhere else to get that done. But if they know you provide it, that might provide an added level of interest for this. Well, as we come into the simple, but sometimes the best solutions are relatively simple. And this is an example of something that is quite simple. The hygienists really got behind this. And again, they went from 3 cases a year to 1 case a week, over 50 cases a year. Imagine what an additional $250,000 in revenue, would be to your practice. I would suggest that would be a great step in the right direction.